Hey y'all, it's Dr. Amanda from Straightsmile Solutions at straightsmilesolutions.com. It's your favorite craniofacial orthopedist and orthodontist. Now, most orthodontic workups stop at the teeth. Some extend into the airway, but if you're not looking at the cervical spine, you're missing the foundation of structural stability. At Straightsmile Solutions, we are exploring the critical evolution of interdisciplinary care, of course, using literature and white papers as the foundation. Today, we're diving into why the upper cervical alignment dictates your airway space, your jaw position, and the ultimate success on your ortho cases. Let's get into it.
Aloha guys, I'm going all in, kind of holistic, a little bit different, a little bit fringy, talking about aspects of dentistry that perhaps we don't learn in school, a little more holistic approach. This rabbit hole has kind of taken me in a different direction than I was expecting. It's turned into upper chiropractic cervical care. And I probably said that wrong, but chiropractors, some of them specialize in upper and some specialize in lower. So this whole upper cervical care is directly related to dentistry. So I posted my whole exam and evaluation that I had with my OMT, and I just did it for fun, basically, just to learn and create some content. I had a few questions and concerns, but it was super minor. I didn't think I really needed stuff. And clearly I did. So you can look at that. It's posted in my YouTube. You can search under OMT if you want. And she recommended in the findings that I go see an upper cervical chiropractic specialist. And there's only a few of those, especially in every city. So today I went to have my exam and I did not know that I was such a hot mess. And I didn't know that the things were going on directly related to some of the discomfort I'm experiencing in my mouth and jaw. So you may have seen, I have a lot of jaw pain, especially the left side. Nothing that an OMFS has ever noticed in any x-rays, looks normal, my bite is good, things like that, some asymmetry. But I've been doing masseter Botox for years, just as pain relief, headache. I have terrible pain otherwise that radiates in my head, down my neck. I'm one of those weird people, but the Botox is taking care of it, but it's really expensive. And I know that us as dentists can do it, but it's still expensive, even if we have to pay for it. I mean, talking thousands per year. My husband's probably going to die if he listens to this, but in order to maintain the pain and function. So I went today and I'm going to show you the results shortly to the chiropractor, and I have severe damage in my neck. And he thinks it's a result of actually all those years of working on patients, causing degenerative issues. So I'm going to be doing a full year's worth of care. I have to go a couple times a week. It's just really quick, 10-15 minutes for the adjustment. I've never done anything like this before, but I can already tell you in just one adjustment, I can tell a difference. We'll see what it's like tomorrow morning, but I'm pretty excited about this. So I'm gonna go ahead and show you my results shortly. I really do recommend that you learn about this. And if you're having any issues, or if you see patients that are having issues, referred pain or discomfort, and you can't find a dental reason for them, consider this. Definitely consider finding an upper cervical chiropractic specialist in your area and/or an OMT, because they're all working together. And kudos to Tamara Thomas, my OMT, for noticing this and referring me to this doctor. She knew him. She highly recommended him. I'm really excited to be going on this journey, and hopefully I can live a more pain-free life. All right, hang on. I'm going to go ahead and show you my results. Thanks. Hey guys, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're here at Hau'ola Chiropractic with Dr. Luke. I'm gonna say hi to him. He is my chiro. He is a cervical chiropractor, and he can tell us a little bit more about what that means.
Yeah. Hi you guys, Dr. Luke here. Just like Amanda said, we're gonna be looking at, funny enough, your films here, Amanda, and we're gonna be looking at a couple of things. So today, this is that lateral cervical we're looking at. The biggest thing that stands out here, this is 1, 2, 3, 4, 5, 6, and C7 here. But if you take a look at this, 3, 4, you'll notice that this area over here, we have a little issue with it, okay? So when we see these squares, you see this joint space here that's really narrowed. A lot of degeneration in this joint, right? So that's one of the things we're gonna be working on with Amanda. But really, upper cervical chiropractic, its big focus is on those upper two bones there. And the reason why it's important is because those two bones, they surround the brainstem. So what we're going to be doing here is we're going to be breaking this down. This film is what's called APOM, and what we found here is that, and if we look at the model, we're looking at these two bones right there. When we see that first bone, we shifted over 0.6 millimeters to the left. On the second bone, we shifted over 2.72 millimeters on the right. So what happens is we have our brainstem here, and this brainstem sits a little lower in the canal, and we have these dentate ligaments, or ligaments that attach the brainstem area to these upper neck bones, and their goal is to protect that bone, that brainstem, from kind of going all over the place. So what happens is, say we shake our heads like that, our brainstem doesn't bounce all over the canal there. These dentate ligaments kind of support and anchor them. So whenever we have this kind of misalignments here, we get some pulling, irritation on that area, and our goal as upper cervical chiropractors is to make sure we get that tension away. So we want to get as least amount of resistance in that area as possible, and when we're able to do that, then we know we have optimal input into the brain and also optimal messages coming down on throughout the body. And that's really what upper cervical chiropractic care is about, is that function.
Awesome. Thank you.